Without further ado, I'd like to introduce William. William sits on the board of the UK Public Health Association and is founder and CEO of Intelligent Health Limited, which uses technology and behaviour change to get more people active outdoors. He is also an honorary senior lecturer at the European Centre for Environment and Human Health, which is the leading centre to understand the health benefits of the national environment. His work has recently been quoted in the Let's Get Moving strategy, which outlines a new physical activity care pathway for the National Health Service in the UK. William has won several National Innovation Awards, was awarded the MBE in 2010 and was chosen as one of the UK's top 100 people to make the world a better place. So I don't think we can do much better than that this afternoon. So without further ado, Dr. William Bird.
Okay, thanks. Thanks very much, and it is always great to be here. I always feel worried coming to Australia because I always feel you're way ahead as the UK in what you're doing in physical activity. When everyone says in the UK, oh, I'm going to Australia to talk about physical activity, and they say, well, why are you going there to talk about what physical activity is about? Because they come here and they're always active and they're always energetic and they're always ones running in London. If you ever talk to a runner in London, it's normally some accent which is down here. So there's a kind of feeling that Australia's got it all sorted out. And so why do you need a task force? Well, you obviously haven't quite got it all sorted out, and things aren't going the right way, not just here, but in the UK and in America and everywhere else. One of the things, just as an introduction, I am primarily a GP, so I still work as a GP. I still see 2,500 patients a year. I keep my hand in there simply because one of the key people we're trying to influence here are the medical profession and the health service, and it is not easy. If you've tried to get up into the health service and try to get them interested and you've come up against a brick wall, don't worry. Don't worry, because that happens absolutely everywhere. We haven't got it in the medical profession there really at all. We're getting there, and I think it's probably the same in Australia as it is in the UK and America, that medicine is starting to realise it can't cope and deal with everything that's going wrong. And suddenly they're thinking, actually, we need help from other people. But that's such a slow process. It's going to take years to get that sorted. But we have to start. So I'm going to try and put the context of how do we put physical activity into the context of where people work in their daily life. So I'm going to start a bit high up, a bit philosophical, I'm afraid. So it's probably a little bit much on a Thursday afternoon. And then gradually kind of move down into kind of practical aspects. And then when I finish, we'll be well into practical. And then I'll stop, and then we'll just, after Griffin has done his presentation, then we'll go into, actually, what can we do? What can we do to make a difference? Because that's what really I'm interested in. So let's start off with the kind of bit of a kind of top level stuff. To get people to be in a good frame of mind and to get them healthy, there are three things in people's lives that we have to get right. People. So if we've got friends and family around us and a supportive community, we'll do well. Isolation is a massive risk factor for heart disease, cancers and other things. So having people around in a community, supported, very important. Place, the place people live. Is it a kind of really horrible hole, concrete, danger, cars? Because that increases the stress level, as we'll see. And purpose, what's someone's purpose in life? Have they got a job? Have they got a family? Have they got a role in life? So we're talking top level stuff, but that is where health is. If you don't get those three things right in someone's life, no matter how much you tell them to be active, how much you tell them to eat properly, how much you tell them to do anything differently, they will not do it. And I'll tell you why they won't do it. Because they live in this kind of world where they're isolated. A lot of older people now are isolated, and increasing number of younger people. The places people live have been forgotten about. So you've got transport kind of right up against cutting off communities, and you've got inner city areas that have been neglected and deprived. And you've got people who've got no purpose in life anymore. Unemployment is starting to go, not so much here, but certainly in Europe and in the United States. And you've got children who've really lost purpose as well. They don't feel valued anymore. We had the riots in the UK and a huge amount of soul searching to work. Why did London have these riots? And a lot of it is because younger people were not feeling valued. They don't feel they've got any role in life. So this creates chronic stress. Chronic stress used to be thought of as going to an interview or having an exam. That's what most people think. But this is a chronic stress where every single hour of the day, if you've got this world, you're under stress. And why has that happened? Well, if you took every hour to 1,000 years, and then from Monday to now is 100,000 years, which is where our evolution has come. So 100,000 years ago, we were hunter-gatherers, 10 o'clock on Monday, if I've done my maths right. All the way through here, we were hunter-gatherers, and then it's only 10 hours ago that we started going into agriculture. And then 4 hours ago, we started having cities, and then industrialization started 9 minutes ago. And in that 9 minutes, our entire body, the way our metabolism and our homeostasis all got to kind of be rearranged and resorted out. Well, it can't. It just simply can't do it in that time. So what we have to do is we have to reconcile the two. We have to reconcile what we were really good at for so long to what the situation the world is now, which means we can't just keep going in the same direction. We have to stop and think and try and put all the clever stuff we're doing into the context of what our bodies are actually good at. And it comes down, if anyone's done biology, those are the little things here. These are called mitochondria. They're our batteries. Hands up who's heard of mitochondria? Yeah, most people have. This is sometimes get blanks. Mitochondria are the batteries. They basically are in every single living species apart from single-celled organisms, so even plants have them as well. And actually the health of the mitochondria decides about the health of us. So aging is all related to damage of mitochondria. And cancers and other things are all related to it. So let's have a look and see how we can look after these mitochondria. If we have our people, purpose and place all sorted out, we have this well-being, lack of stress, therefore we tend to want to have a healthier behaviour, and we get the mitochondrial repair. So the mitochondria, you've heard of free radicals and you've heard of antioxidants, so we eat lots of antioxidants to try and get rid of these horrible free radicals. Free radicals are actually being created all the time, and you just want to have those repaired. So if you have all of this right, you've got lots of repair, very healthy, active lifestyle, eating lots of antioxidants, you've got it sussed. That's health. Those are the mitochondria in the green. It's got lots and lots of repair. If you get it wrong, where we're heading towards at the moment, we get this chronic stress, and then our healthy behaviour starts to go wrong as well. But one thing I forgot to mention is resilience. When children have a good upbringing, of healthy upbringing, stability, with all those things right, they create a resilience for the rest of their life. In fact, that resilience starts almost prenatally. So the health of the mother influences how they live. So if you have children who are having a really stable, loving, active, healthy lifestyle, that will set them up for the rest of their life. So that's another factor. You can change adults, but basically we've been pre-programmed. So it's genes and it's the situation people live in. But this healthy behaviour, what is a treatment for chronic stress? There's a really good treatment for chronic stress, which actually gets rid of that stress really quickly. And so these are the treatments for chronic stress. Most of them we wouldn't really want as healthy behaviour. Right, inactivity. When you're really stressed and you're really anxious, actually you don't want to go for a run. You don't want to do any activity. You want to sit down with a bowl of crisps and just sit there and cope with that stress. That's the number one treatment. Number two treatment is to actually really get some good fat and sugar into you immediately. It hits your dopamine, and immediately that stress seems to be improved. Number three is smoking. That actually really helps with the stress. Immediate, it's again hits the dopamine things in your brain. And finally, having alcohol. So it's not surprising that this unhealthy behaviour is dealing with one problem, and that's what people, so if you go to a small little shop, what have they got? They've got an off licence to drink, they've got cigarettes, they've got sweets, and it's just local, so you don't even have to walk very far. And this is how we have all adjusted. So if you tell to someone, go for a run, completely isolated, and you've forgotten all of this, unfortunately, you're not going to get much of a response. You might get a response, but it won't be very polite. So chronic stress creates this unhealthy behaviour, and chronic stress actually has a direct effect on the body. It produces steroids, cortisol, that's liberated by stress. What happens when people are on steroids? They get overweight, because steroids actually make people overweight. So your whole metabolism starts to go towards obesity. And you get this damage of the mitochondria. And what happens when mitochondria are damaged? Surprise, surprise, direct link to cancers, direct link to heart disease, direct link to diabetes, direct link to dementia, and direct link to depression-ish. Well, I'll explain about depression. These have got good evidence that mitochondrial damage do this. So in medicine, when you talk about physical activity, although most doctors know about it and they think it's a good thing, we're talking up here. Doctors like dealing down here. Planners should be dealing up there. So your physical activity task force that's got all the people together is to get that right, but you also need the doctors to mop up at the bottom, and hopefully this will fall out of having that corrected. So that's why we've got it all kind of, we've got a match where people's roles is in this whole thing. Doctors don't see really above that line. They should do, but they don't. And that's the problem. You know, I've been a GP for 22 years, and all my training is down at the bottom. So everything I see has to start with, if you say actually physical activity will prevent Mr. Jones sitting in front of me from his diabetes getting worse, I'll listen to you. If you say physical activity costs the country $8 billion, whatever, I'll say I don't care. But I do want to know what happens to Mr. Jones in front of me. That's how doctors work. And we've got often the wrong message. To politicians, yes, $8 billion, whatever it is, it's in the UK it is really important. But to GPs and then to the public, you say, oh, you won't get dementia or diabetes or heart disease if you start to become active. Actually, they say, I don't really care, because that's not going to get me to go and stay active every day. The only reason I'll be active every day is if I really enjoy it and it makes me feel good. So different messages for different people. I mentioned depression. Chronic stress has a direct link to depression. So there is that aspect. So this is a map, really. And what we have to do is to make sure that the unhealthy behaviour bit of physical activity is in that context. Okay, so this is all about, as I said, top level stuff. So when we start there, we start to think, actually, yes, these things do strengthen your heart. Having a nice environment slows the aging process, reducing stress all the time of how we actually work. And stress is only there to protect us, because as a hunter-gatherer, we used to have a nice areas of green space, there's some water, no hostility, we don't want to be we don't have fear. So that's why we have to be respectful for our past and not just go straight into technology to try and help us to get better. So let's have a look at a few things. The evidence about environment, as Fiona here, and it's always worrying talking when Fiona's here. Fiona Bull, who's the world expert on physical activity. I say that with big V in front of it. The evidence about the environment and physical activity is still there, still being developed. I mean, this was from a BMJ some time ago now, where they looked on the EU and obesity and physical activity related to greenery and tried to adjust for everything, because obviously posh people live in green places and poorer people live in non-green places. But as much of that control that was managed, there was a trend. And in Indianapolis, they followed up 2 groups of children for 2 years and again control matched them, so that they were the same kind of children, same background, same income. And those that lived near a green park actually put on less weight than those that didn't. And for the 16-year-olds, it was about almost 6 kilogram difference between the two. Now, some evidence comes out and says actually there isn't a relationship between green space and physical activity. So we still don't quite understand, and Fiona would be the person to be able to help. But what we're probably looking at is not just because a green space is a place to go and walk and run, of course it is, but actually that greenery around is creating the mind state, the mental state, reducing the stress, making people feel better to actually want to do something. If you have to walk across a horrible industrial park or a massive road, you're not going to really kind of encourage people to become more active. So green space is important on this. Open space, the whole thing about the environment, as I was talking about. Now for physical activity, when I'm talking to GPs, I have come to this slide here. Now you'll probably all know this if you're involved in physical activity. This evidence, it went from moderate, weak, moderate. They're all starting to get strong. This was the latest one from, I think it was from the United States version. And you can see that the risk reduction is quite big. And a lot of doctors don't know that colon cancer, breast cancer are related to physical activity. And they think that heart disease, actually the top one is hypertension and cholesterol, and then it comes diet. And then they always put physical activity way down at the bottom, even though it's absolutely equal to the others. So there's a kind of misunderstanding, there's an education problem to a lot of the medical profession. But that's an impressive list, a really impressive list of any medication that you'd give which had that. It would be compulsory for everyone to take it every day. People would be sent to prison if they didn't take it, because it would prevent massive amount of ill health in any country. And the other way of looking at it is to compare physical inactivity to the normal ones, the ones that most GPs understand: smoking, cholesterol, hypertension, diet. And if you look at the list, things start to really come out. We all know that for heart disease, all those 5 are really important. And for stroke, all those 5 are really important. Cholesterol, not so much actually. It's after you've had a stroke it's important, but not preventing a stroke. But for prevention of diabetes, only inactivity and diet. Stopping smoking won't prevent you from having diabetes, and your cholesterol has nothing to do with it, nor high blood pressure. For depression, cholesterol, hypertension, diet don't have any impact at all, but physical inactivity does. For colon cancer, you started to get this cholesterol, hypertension, nothing to do with it, smoking a bit. And breast cancer, smoking doesn't have any effect on it, but physical inactivity does. Nothing else seems to work. Even diet, the evidence on it is pretty small. Hip fractures, lung cancer, dementia. You can see that these other big risk factors have real holes there where they actually have no effect at all. It's only physical activity that actually makes the difference right across the board. And even prostate cancer, I think that's right, Fiona, isn't it? Prostate cancer now has just got a 1+ of prevention-ish. And lung cancer has a 1+ prevention-ish. I mean, that's stuff that's probably not quite there yet. And the big thing is, if you look at mortality, cholesterol, reducing cholesterol actually doesn't appear to make a big difference on end death rate, mortality. Despite statins and all sorts of drugs being pushed out, it definitely helps heart disease, but the endpoint doesn't make much difference. Now, GPs do start to see that in the context of their life, day to day, and that does make a difference. So those two make a difference. And I put these in pounds. The quality adjusted life year, this was published by the Department of Health. So that's a year in your life where you've got good health. So how do you pay for that in the health service? How do you achieve that? And it's a unit that's used in health. Well, £17,000 for taking statins to help cholesterol, to get 1 year of good quality life for an individual. That's how much it costs, because you have to treat loads of people to get that 1 year. Smoking cessation, a lot better, it's 9,000. And for physical activity, 400 quid, £400. Now those figures you can say, well, it wasn't, it's double that, or okay, £800, or times 10, oh okay, £8,000. It's still incredibly good value. And the Chief Medical Officer says physical activity is effective in treatment of clinical depression and can be as successful as psychotherapy and medication. So why aren't GPs prescribing physical activity for depression? Good question. It has the same effect. Our Chief Medical Officer told us it does, and yet it's still not being used. Still much easier to get someone to take treatment. The reason, actually, why GPs don't do it is because it's much easier to give someone a tablet, and the effect they're going to take it is probably going to be more than if you have a depressed patient to try and get them active. Really hard to get depressed people active. So although we know the evidence, we haven't got the tools to actually be effective in delivering this physical activity. This will probably just go on to where Griffin is. This is one of the other problems we're getting now for physical inactivity, is for children who are starting to struggle to see how they can actually become active. This was 4 generations of one family. So this is a great-grandfather who had a 6-mile radius to walk around every day for his friends, and he could just go down fishing down here. But this is where he used to live, and he had this whole area as his playground, being active all the time. His son, when he was 8, just had a 1-mile radius, but there was woods there and he had fishing. The son's daughter, when she was 8, at 1979, was allowed to go half a mile down to the swimming pool. And then Ed, who's now 8, his radius is 300 yards, 300 meters, where the mum can still see him. So in four generations, you've gone from his 6 miles down to this tiny part here, the ever-decreasing circles of activity. And what we have to do is you have to change that environment there. I'm going to leave stress out because we're dealing with that, but I'm going to now just deal with health inequalities as well, because that's one of the biggest problems we've got here in the UK particularly. And again, if you want to talk to policy people and you want to talk to politicians, the inequalities of health, and this is how, and I'll say how green space and physical activity can deal with it. But let's look at green space here. If you have the highest income living in no green, so right in the middle of a city, and very green, the incidence rate of their death hardly changes at all. Okay, so wealthy people, doesn't matter where they live, the environment doesn't seem to be very important. For middle income, apart from this blip at the beginning, there seems to be a very slight line going down where the more green they live, the more they actually live longer. So the higher it is, the more likely they're going to die earlier. For very poor people, the line is even steeper. So this is a very green, and then this is very little or no green at all. Now the thing to look at obviously first is actually the massive difference between there and there. You know, that's what income does for you. So living, if you're very wealthy or you're not wealthy, then the gap between those is huge. So if we look at this one here, it's almost double the risk of dying early if you're poor compared to if you're rich. But when you come down to a very green area, that gap's narrowed, and that's reduced the inequalities. So actually having an environment, a green environment, you know, the people purpose place really does seem to make a difference to helping the people who've got the most stress, who are those who are poorer, to actually live longer. So this is perhaps this evidence of people, a place where they live, that you can actually make a difference by the designers, by the planners. So however much we do on changing people's behaviour, if we don't have that environment, we're not going to make much difference. So that came out in The Lancet, which is a good medical journal, and it shows that you can reduce that gap just by having much greener area in where people live. And the mayor of London, Boris Johnson, has said, raising awareness of the health benefits of access to nature and green spaces to extend these benefits to all Londoners. So big areas of London are now being looked at. Why have we got such rubbish environments for these people who need a better environment to hopefully then become active? Okay, so that's the background of it. I'm going to say a few things about what we're doing, but we'll talk about that much more. You can ask questions about actually what we're doing. I worked for Natural England before. The government, we've got a Conservative government, and they've basically slashed everything in government. Government hardly do anything now because we're bankrupt in the UK, so having to pay back a lot of money. So Natural England was doing a massive health project. Unfortunately, that stopped. That's why you'll see Intelligent Health at the top, because we've all been encouraged to go off and do our own things with our own companies. But when I was with Natural England, we created this Natural Health Service to try and say, look, if you have a natural environment and bring it to people into, so if you go to an inner city area and you bring a much better environment, you can increase health. Likewise, sometimes you have to ship people out into the green space because they're not using it. You've got fantastic parks, but nobody's using it. So it's trying to get the environment into people and people into the environment. I'm going to talk about one of them. That's Walking for Health. It's the largest walking scheme. I actually set it up when I was a GP, 1996, because the patients with diabetes were not walking. They weren't doing any activity at all. They said, I don't swim. He said, I don't go to the gym. I hate sport. I'm 55. I've got a big beer belly, and I'm not going to be seen as an idiot going out there. So there's no activity for me. And I said, well, there is. There's walking. But they didn't do that because they felt, A, it wasn't an activity, and B, they didn't want to go on their own, and C, they didn't know where to go. So we set up this walking scheme. So it's gone at the top. It's about 175,000 walks a year now around England only, with about 1.8 million contacts. It's a short walk, it's graded, it's definitely encouraging people who do no activity to do some. There's a walk leader at the front and the back who are all volunteers, and they try and walk briskly. Okay, so these are happening everywhere, so that's in the southwest as a kind of example. What we're trying to do, in fact, what's happened is, again, government has said, no, we don't, we're going to step back from this now, but we've just secured a grant from a medical charity to hopefully take this on for the next 3 years and grow it even more. I mean, the aim is to get 1 million walks a year to get to every single corner of the country. And then we're hoping a big environment organisation will deliver it, and that's going out for competition for someone to do that. So by February, we'll know exactly the fate of where Walking for Health is going to be. The kind of structures, you have a very small national team, which will be about 6 to 8 people only, and then 1 or 2 regional people, not many, and then you have the scheme coordinators, which are either part of the health service or part of the local government, who do perhaps for half a day a week. That's all they need to do. They just make sure the timetable's there and you've got people being trained up. The walk leaders are volunteers, and we've trained up about 50,000 of them, but there are 10,000 active at the moment. And then you have the walkers at the bottom. So these two, this is what's up for sale really. This is what's been funded to get the brand right, etc. Scheme coordinators are all local people anyway who are employed in government, or volunteers, but mostly government. And then all of those are volunteers. It's mostly middle-aged to older people. And interestingly, it's mostly women, although that is slowly shifting towards more men, as we have more men walks, particularly only. So what this does, if you remember that people, purpose, place, it brings people together, and that's one of the biggest drivers for people to keep coming back because they make friends. I think there are about 40 marriages that have actually taken place now from health walks. So it shows they do really get to know each other very well. A lot of people isolated can come onto this and feel quite secure. The place, it introduces people to places where they live, but they've never been to, or they haven't actually understood it. So green spaces they've not gone to before because they've perhaps felt insecure. 80% of women will not walk anywhere on their own because of fear of crime. And finally, purpose. It gives a a regularity. Now, a lot of us, we forget how people who are isolated and retired or unable to work have really very little structure in their life, particularly when there are no people around them. So this provides people purpose and place. And that's probably why it's kept on going. Despite all the times when money's been withdrawn, it keeps growing constantly because volunteers keep coming back, people keep going on to it. Another thing which we're doing is for children. So this is called Beat the Street. We've got the Olympics coming next year. And we developed, when I say we, Intelligent Health, developed a competition which is going to be between London and New York initially. Children basically swipe a card, they all get given an RFID card in the school, and they just swipe it on little receivers on the lampposts as they come into school. That goes onto a website, and one school versus a New York school will be head to head on the percentage of children at walk who've got cards. So it's going to be online all the time, live, to see who's doing it over a 4-week period, 3 or 4 week period. But the aim is to try and get secondary school children a little bit more interested in walking. Primary school we know is okay, secondary is really tough. So the pilot's going to be evaluated quite heavily starting in 2 weeks' time, and then the main competition will be in May, just before the Olympics, and it's an Olympic sponsor that's funding it, and hopefully that will be then taken off. Afterwards, in 2013, it's already going to be a not-for-profit company now, which we're setting up. But any school anywhere in the world can actually take part in this and match against any other school, or any city can match against any city. Now, you think that's technology, that goes against what you were saying earlier. We need every little bit of incentive to try and drive people back to that people, purpose and place. So when we did the work in London beforehand, we found that children actually started to talk to each other a lot more. A lot of evaluations showed that people started to see the places, so when they didn't use a bus or didn't use a car, they started to actually understand what was around the school. So these real subtle changes were taking place in children's minds, and we know that there's a very good correlation between children who start to become active earlier on, but they may carry on being active later. And the cost benefit for Transport for London and for others was really quite staggering. Their economists looked at it, and what they put into it, the cost, and what they got out of it meant that for every pound or dollar they put in, they got $24 back of savings. So these are just, although technology unfortunately is one way of doing it, it doesn't mean that technology replaces that people, purpose, place. It's a way of getting into that area where people want to work. The Green Gym is another system, which is another scheme, we call it, which is around the country, and it's to get people to actually improve the environment where they live by actually digging it up and conserving it. So it's doing both things. It's run by British Trust for Conservation Volunteers. It works with GPs as well, and people can actually take part in this, understand about conservation, and the conservation actually improves the area where people walk and live. So you start to get that place being improved, a huge sense of purpose and a huge sense of people. So people, purpose, place again comes back again. And my best move, which is Let's Get Moving, and I'll talk about this a lot more, it's just a variation of that. That's the Department of Health pushing GPs to understand how they can actually refer patients into activity, which is not just into a gym or to a leisure centre, but doing any kind of other activity. You know, a lot of those are probably too extreme, but it's just to get them to actually walk, come back again, and be seen by a motivational interview person who's done the interview with them in the practice, in the GP practice, to find out how they've got on. So GPs refer a patient who's got diabetes or hypertension to one of the staff in the practice who've been trained up in motivational interviewing. They have a 20-minute appointment. They then sign a kind of little contract which says, yes, I'm going to go do this. I'm going to phone up this person, this Zumba dancing or whatever it is, tomorrow, and I'm going to come back in 4 weeks' time and we'll see how you got on. And what it's trying to do is then use the patient to understand how they should see it all, not telling them they've got to be active because that's good for their heart, because that won't work. So we can talk about the detail of that one as well. So it's all quite simple, really. What we have to remember is we've got this context of a real problem in the West, where obesity and physical inactivity are rising despite the fact that everything else seems to be looking good. And we put sports centres up, we build parks, we spend loads of money, as you probably are here, on getting people to be active, and we find it's very hard. It doesn't really work. And what we have to perhaps think back now is looking at, in their point of view, is why would they want to become active? If you're really struggling in your life, you know, it doesn't matter where you are in your life, but if you're really struggling, if you've got other priorities, how do we actually get physical activity? And it's getting its pace right, it's make sure there's enough people around them who are going to support them to do it, and it's make sure they feel there's a purpose, that actually it's going to be valued. And then once they value themselves and once they value around them, they will actually start to slowly change. So planners need to be involved, transport people need to be involved, education need to be involved, health needs to be involved, and sport and recreation. All the people you've got on the Physical Activity Task Force. And we mustn't be surprised if nothing happens for the first 10 years, or very little happens. It will take a long time. Look at smoking. 60 years it took from the discovery that smoking was bad for your health to banning it in most countries. That was 60 years. Hopefully we can fast track it a little bit, but I reckon we're about 20 years. I think Stephen Blair and the big Paffenberg and people back in the mid-70s, late 70s. So we've had the whole of the 80s, the whole of the 90s. We're 30 years there. So perhaps we've got another 10 to 20 years before we can really put physical activity back up there. But we're going to get there. And then the environment fits into this completely. And if we can get the environment right, the cities right, and physical activity is a priority, then GPs will find it part of their normal process of referring patients to physical activity and understanding it. But don't give up if you feel it's a slow process. Thanks very much.
Over to you, Ruben. Thank you very much.
Cheers. All right, well, thanks very much for giving me the time to speak to you all. And thanks for that, Will, that was fantastic. It's been a very dramatic 9 minutes. I think we can all understand that. The 9 minutes that William was talking about in terms of the progression of human history. And I think when we think about that, it's very important to bear in mind where that's most profoundly felt. And I think it would be hard to argue that there's anywhere where it's less significant or less profoundly felt than in the experience of childhood. The way modern children experience their lives, obviously they've known nothing else, so it's not anything different for them, but for us who have had a different experience looking at it, we can see that throughout the whole of human history, childhood has been of a particular flavour and of a particular kind. It's been about activity, it's been about creativity, and it's been about freedom. And what we're seeing now, as you all know, if you've got kids or grandkids, or you're in the education sphere, or you're in the medical sphere, kids' lives are increasingly being spent in isolated, sedentary, computer-based entertainments. So that's sort of the starting point of what nature play is. It's recognising that and asking the question, what impact might that have? And is there anything that we can do to try and address that? And I suppose before I go too much further in, I just want to draw out those two words for a second. You've got nature and you've got play. Now the first one, nature. At Nature Play, we try and make a distinction between, well, we'll try and break down the distinction of nature being some pristine thing off in Karijini, or one of the great national parks in the world. We want to think about nature being everything that's outside your door, because so long as nature's this pristine thing, it becomes unattainable. There's all sorts of barriers. Do you have enough money? Do you have the right vehicle? Do you have a good enough tent? Do you have the Mountain Designs jacket? There's all sorts of things that get in the way of you doing it. But if you think about nature being everything that's outside, then that's beginning the process of getting children and their parents outside and engaging with the natural world, which inevitably, as we all know, leads to physical activity. The other word is play. And it's a word that rolls off our tongue very easily. But what do we think about? What is play when we talk about it? I think when you listen to people talk about play these days, increasingly what people are really talking about is digital entertainment. And I think we have to recognise that there's a very great difference between entertainment and play. And one way to think about that is electronic entertainment deserves the name of play in about the same way that colouring in deserves the name of art. All the creative work has been done, and the child's left to fill in the gaps between. And that's a really comfortable space for an adult to be in, because you give this activity and the child is engaged and does it and they're safe. And we're very good at giving kids colouring in activities of all kinds. But finding ways to allow them that space to be creative again is really important. So Nature Play, as an organisation, essentially we're a collaborative organisation. We've got 19 founding partners, people from the environmental world, Department of Environment and Conservation, Conservation Council, people from the medical world, the AMA, the Royal Australasian College of Physicians and others, people in the sport and recreation field like the Department of Sport and Rec. And basically what we've tried to do is bring all those people together and come up with ways that we can cooperate in those different spheres to make changes for kids. Some of the initiatives that we're working on at the moment, we're working with schools to try and change the way that homework is thought about. We've got a homework diaries initiative that we're just starting to work on now. And basically it comes from the idea that when we talk with adults, we're always talking about getting a balance between work and life. We like to separate those things, but the work-life balance. But with kids, we're increasingly loading them up with more and more homework, more and more activities. So the idea behind the Homework Diary initiative is to put one line at the beginning of every day's homework page, and that is simply go outside and play for half an hour. And the idea behind that is one of the first questions a parent will ask when a child comes home, unfortunately isn't how was your day, it's have you got any homework? And what we'd like to see is the kids say, yes, I have to go outside and play for half an hour. After that, if they come in and they have to do some athletics or some reading, the research tells us that their minds will be sharper, they'll be better able to retain what they learn. And particularly when you think about that in contrast to what they might otherwise do, which is come home and sit down in front of the TV for half an hour and eat crisps like we saw on that slide. The nice thing about that is that the child is getting that encouragement to get outside and play from two of the primary adults in their life. So the teacher is essentially setting that activity for them, and the parent is asking the question and having to sign off like they do in homework diaries. So the kids sort of being triangulated and really encouraged, and everyone's recognising the benefit of getting them outside. We're also trying to encourage the creation of family nature clubs, which is something that's been done in the US quite successfully, which is essentially like a playgroup. It's families who come together and go out into nature together to let their kids run amok. You know, I kind of like to think about it in terms of a picnic situation where the adults are there and they can see the kids, but the kids are able to run around and explore and have that creative space that's so important to their development. Other initiatives we're working on, we've put together these passports that we're calling Passport to an Amazing Childhood. And essentially what they are, it's a very beautiful little document, and it links to some online missions. Now, this is another instance where we're trying to use technology to get kids outside. We encourage them to come to our website and log on and register their passport. And when they do, they get a passport number which they enter into their book, and that number then unlocks a series of missions. There's 10 of them that increasingly get them out of the house doing things. When they do them, there's a sticker inside the book they get to put on the page. So it's a way of trying to encourage and lead kids outside. Another thing we're working on, which is really what I'm here to just give you a very brief update on, is that we're investigating a Green Scripts initiative, working with our medical partners, the AMA, actually the Royal Australian College of GPs, PATF, and also Medicare locals in Northern Metro, as well as DSR. Essentially, what we're looking into is there a way, and this is actually ties in very closely with what you were talking about, William, is there a way that we can link the parallel efforts in this sphere? Because really when you look at it, there's an enormous amount of effort and resource that goes in from the medical side of the world, trying to encourage and foster the health of our population. And a big part of that is trying to encourage people to be physically active. On the other side of the equation, there's an awful lot of people trying to actively encourage sport, recreation and physical activity. All the clubs, all the walking groups, all the people putting trails into our national parks, an enormous amount of work trying to get people to do that. But there's really not a lot of ground where the two come together and work together to form the most effective way of getting people out. So the idea is with the Green Script, essentially, that we are encouraging doctors to prescribe that activity. Once again, though, we're using the internet. What we're looking at is using the internet to facilitate that. So while the doctor spends a very brief amount of time prescribing that activity, the patient then goes to the website and there's much more detail there directing them to where they can go, what the trails are. If that walking group idea is a fantastic one, if something like that can be started, that would be on that website. So it's a way of trying to encourage it and bring those two things together. As you can tell, as I'm talking about it, we're very much at the beginning. It's really only an investigation. We're going to have a series of workshops working with GPs, trying to find ways to make it work for them. The biggest challenge in our early discussions, there's been lots of ideas about how we can do things that will be good for patients and how things that will work well for patients. Lots of people have very good ideas on that. Making it work for doctors is quite a hard thing. Doctors have very small amounts of time to see their patients in, and anything that's seen as adding a burden to that time is rightly, in many ways, going to be resisted. So our challenge is to try and find a way where it's taking what people already do and making it more efficient, make it measurable, and link it to the efforts of other people. So that's the mission we have in front of us. As we go forward with it and we have those talks and workshops, I hope to be able to give you more updates. But essentially, that's the challenge we have in front of us, and I'll let you know much more as it happens. Thanks very much.